I'm Dr. Rajdeep, gastroenterologist at Gastrocure Endoscopy Center and Liver Care Clinic. Today we'll talk about a condition which a lot of you might have heard about but do not know in detail. It is known as Irritable Bowel Syndrome or IBS. So, Irritable Bowel Syndrome is primarily a group of symptoms such as abdominal pain, bloating, upper abdominal discomfort, and either diarrhea or constipation. So there is a subgroup of patients with IBS who have either a lot of diarrhea, frequent bowel movements all the time, or there is a subgroup of people who have constipation and inability to clear the bowels. So every patient with IBS requires individualized treatment and no common treatment works for all patients. Now, what are the do's and don'ts of IBS, or what is it that you should follow to prevent frequent attacks of IBS? So, first of all, the meal should be spread out throughout the day and should not consume heavy meals at one time. Small meals throughout the day with a regular frequency works better in irritable bowel syndrome. Also, regular exercise and movement to your bowels is something mandatory for treatment of IBS. There are some foodstuffs or food ingredients which should be avoided. These are the foodstuffs which are known as high FODMAP diet, or the category is known as high FODMAP, that is fermentable oligosaccharides, disaccharides and proteins. So these are the stuffs that you should be avoiding, and your diet should be low FODMAP diet. So that includes a high fiber diet and a low fat diet. There are some foodstuffs which increase the gas production such as chana, rajma, or some sprouts which should be avoided with patients with irritable bowel syndrome. Consumption of dairy products should be done in moderation, and a regular exercise should be maintained. Working on your obesity should be advised and advocated. In case if you have any symptoms of irritable bowel syndrome which are persistent for a longer duration, you should always seek help with your gastroenterologist and get it treated.